we all face these all kind of, people also, and we ourselves also feel sometimes. We are sometimes good, sometimes bad, sometimes ugly, isn't it? So yoga helps in what? To keep you good, bad or ugly? So we keep swinging between good, bad, ugly. So by yoga, we try to reach again and again to good. And everybody has their own good. There is no definition of exact good. So yeah, some of the people are very common, evidently right. Like sunrise in the east. You can't say anything else than this. There cannot be any other paradox. Such a person, the treatment has started in the golden time. Treatment can take any long. It can be 30 minutes this. Then if hospital is close by, then you have to do the defibrillator. There are machines which do the jerk to the heart. So actually here we don't use it so frequently. In foreign countries, every place there is a defibrillator machine, or even on the railway station, and anybody can use it. They are taught that machine to use also, because that is faster, doing by hand, and that is a faster, and that is calibrated and calculated. So you just have to push the machine and put those electrodes and jerk the person.
So this one, see, for example, if someone is telling chest pain, and by seeing itself, he will just lay down and he'll become unconscious.
Look, listen and feel.
Okay. So
if you look, listen and feel, you will come to know there is no breath. Basically, you have to ensure there is no breath. There is no pulse. Listen. Okay. Either you can listen this or heart. If one can feel the pulse, then feel the pulse. If it is not there, breath is not there. And that is the right time. Cardiac arrest is the best event. There are so many people at home collapsing. And if you know that CPR that can save your loved ones, you don't need to go for the emergency scenario. Every home will have an emergency. Nowadays, as it is with the cardiac arrest, people are dying like anything. So anybody who falls inside the house like this, do that immediate CPR.
Madam, unfortunately, so one of my close friend, actually his father, so he died with heart attack only.
So if somebody is there and a person is not too
right at office or at home, home only, right?
So
see, they could have.
Do CPR? Why? Everybody is just rushing and running to hospital. We have to do the emergency work first, because why? The golden time is, and we are wasting for hospital, calling this and that. First, you attempt your work. That is very important. That can fully save. Because the time which is taken to take the person in hospital, the golden period is over.
Precaution in the heart healthy.
That is another talk.
Big story. See, not only one, this is not simple answer. See, all yoga and diet and everything, it matters,
Today
and our lifestyle.
We are talking about CPR. So anything related with CPR, how to handle this emergency, especially so many homes must be having. Your dada, your grandfather, anybody who just lie down, you do this. If you can ensure, and one can ensure the breathless, the breath, without breath person, one can easily, identify and say, there is no breath, no pulse. So do that CPR. Immediately, at least nothing, 3-4 CPR, at least attempt, you never know. They just revive back.
But, without our, sometimes, maybe our guess may be wrong. So, by hurry, if the person still,
that is why I said, look, listen and feel, that give 10 seconds to that.
Okay.
So, first of all, to keep yourself calm and composed.
Yes.
Take deep breath. Okay? How I should be handling it, first plan it for 1 or 2 seconds, rather than jumping on to that thing. Okay? If person is died and you take 10 seconds to ensure that yes, the person is dead, is not going to harm. So just not doing the CPR, doing the right CPR, doing to the right person, and doing in a right way. For that, training is needed. Otherwise, you can put the YouTube and you can do that. No. That's why the regular training, workshop, understanding of the things are very important.
So we are not giving the importance to our life.
Training.
Okay.
Training. Very
Yeah.
important part is training in life. Train for everything. So a little about first aid. So I don't have much time. So I also bought one for Apollo Pharmacy only. So everybody should have first aid box in home.
How many of you have the first aid box at home?
What you have in first aid book?
He is always don't know.
Always got
Huh?
bad negatives.
It is somewhere above the switch. How can I reach it? I don't
Very
know.
bad.
I
You
don't
are the
know
person
where
who
it
is
is.
going to use first aid box
I
maximum.
don't know where it is now.
So today you will go and search, right? Today?
And you will find out what it is there. That's what I say, na. That is our attitude. I don't know how I should do. Anybody said no to you? If you will go home and tell your mom, I want to see this first aid box, what is there inside? She will say no. But curiosity should be yours.
I asked Darwin today in the morning. She was like, I don't know where it is. Ask your father.
Then we are bad parents, I should say. I am so sorry. You are unfortunate. We
I
are all
asked my
bad
father,
parents.
he was like, ask my grandmother. And I asked him, she's like, I don't know where it is.
So then I am so sorry. We are all bad parents. You have to bear with us. Today at least you are.
I was finding here, I was finding my mother, we don't have any first aid kit. I'll buy it tomorrow cheaper.
Ask her which puja mandir you go, mom. Which mandir you are going today? Okay. Then explain her. Doing good things, being kind, being good. Chennai lost so badly. Huh? All out. Hmm? Good. That was in stadium only. So guys, I introduced myself. I am again Dr. Priti, and today I will be taking for your class. And I don't know about what language you guys are comfortable, but I can speak Hindi and English.
English is comfortable, right? Everybody?
English is
Huh? English is
English is
comfortable.
fine. So I have two portions which I will cover. Though I can talk for so long. I can teach you so much. I can make you a half doctor. But time doesn't allow me. So I'll restrict my talk to two areas. One is CPR. Anybody know CPR? Full form of CPR.
Yes.
Look, 11, 12, you guys are studying, and that is what your knowledge. You will go, I'll ask about the what Turandar 2 is doing, 1 is doing. Everybody will, like a PhD, will start talking. What kind of knowledge you guys are having, and you guys are going to compete US? Not even the close to it, yeah. Though Modi is so bragging about our country. These are our country people. In US, if 5th class person you ask, these are the questions they are answering, and they questioning also. You are wrong. So guys, please buck up. Don't succumb to your environment. Your parents may not have got those opportunities, but you guys have. Know, always know things. Increase knowledge and understand knowledge is not duranda. Nobody is going to ask you, or it is not going to help you. So don't go in easy way out, okay? Which path you should take, which are tougher. That only pays later on, isn't it? Or not? There is no free lunch. It is time tested thing. There is no free lunch. More you put in effort you have to keep putting. Okay? So even your parents do ask you to study, do games, it is by experience. Though it is very bad, we also felt so bad about our parents. But right now it is paying us knowledge. Always whenever any question to come in mind, please Google it and try to find the answer. You will become Einstein out of it. Okay? And always think big, dream big. Go less than this. So you want to go with Tesla or who is that? Elon Musk. You want to go with him? You don't know? I really like it. He's not good. He and Trump, these two are my favorites.
Are you telling about the Tesla Model X?
Huh?
Are you telling about cars or something else?
It is, I just said the company. Tesla is a company. Elon Musk is his.
And even on the
So
models.
you tell me which is his the latest investment in the universe projects.
Cybertruck?
Cyber
Cybertruck, Tesla.
Cybertech. Yes, he is Cybertech. But right now, what he is doing,
That I know.
you guys will not
Basics.
make sense in one portion. But his plan is to put robot govern satellite. Understood my point? Anybody? You are understanding? We can't send right now humans on Mars. So what will do? Second best option. We send robots with the program. So they will create the life over there. Okay? And at the same time, the satellite will be put in such a way they will harness so much energy from the sun, and any problem of energy on this earth will be sorted. Okay? So that kind of plan, yes. That kind of mind people have. And you guys are not answering something. That's all. So CPR. We're coming again back to the CPR. CPR, Cardio-Pulmonary Resuscitation. CPR. Okay? Clear? Cardio-Pulmonary Resuscitation. Anybody has doubt about the resuscitation word? Resuscitation is an English thing. Don't you know that much English? It is like revival. Okay? Cardiopulmonary revival. So today I will talk about CPR one. Our second is emergencies. Day-to-day emergencies, what we do and what we should do. Okay? So we'll start with the CPR. So three things I will tell you: when to do, what to do, or how to do. Three things. Who will speak? CPR I will talk 3 points. When to do, what to do, or how to do. Speak. Tell me what 3 points I have told.
When to do, how to do, or what to do.
These 3 things, if you are clear, you can revive any person who is dying. Do you want to revive? So many. So you become my subject. Pause. Just pause here. Like just sit here unconsciously. So this is our subject. Okay? He has met with the accident.
Close your eyes now. Yeah.
He's half dead. Okay? So what we'll do, first I'll tell you, sit here, then we'll do, you please listen. So 3 things we have to do. First we have to ensure कि we have to do cardiopulmonary resuscitation or not. First, that is the most important thing. You will do a cardiopulmonary resuscitation to a living person, he will die with your cardiopulmonary. So first you have to ensure. So first word was when to do. That ensure you have to do. Okay? When to do. Which patient, which person you should do the CPR. Okay? When again. Second is what to do. So in what to do, I will tell you the procedure. how to do, what to do in that kind of scenario, what all things, all precautions you have to take. What, how to do is third portion, where I will tell you the exact scene. Okay, 3 portions. Okay. So I will do the practical way, so you remember better. So this is the right person. Okay. So whenever you see such kind of a person where you are feeling the person is alive or not, so you are Charan. Come. So come besides you see. Okay. So first, what you have to do, the person is like in such a situation. In the car, he is like stuck to some place, some area, half up, half down. So the first thing what we will do is we take the person and make the person lie. Just you are only remember you are the one person in that scene. Slowly, and in that thing you have to ensure one thing: the person is not moved too much. So try in such a manner to just little drag and just make them lie down. Yes, that's good. So first the person is, you have to take out from the scene of the emergency first. Okay, understood? Scene of emergency, and which is the closest place. Okay, car, then just drag them out to the road. Okay, if they are in the burn scenario, just take them out from the burn scenario. If they are like they are in the like those mines and anything, the stone, when you are going for tourism, there is a car which is on the, which is in the ditch. So just take the out person to be, even in the car only you make them the straight first. So now second. Your turn. So a second portion is, one is what? Right? So it is the first scenario preparation. So when to do. So to ensure when, come with the person, whosoever. Okay? Right now you are feeling the person may not. If person is little alive, like breathing, talking, murmuring or anything, then nothing. No CPR. Zero CPR. Don't even touch. Just make them lie down and call for help. So that is the first portion of this exercise. What you should do? Whenever you see such patient who is alive or not alive, what you have to do? Call for help. So call 3 times.
Help.
Shout, help.
Help. Help. Help.
Nobody will come to help you. Soumya is going to die.
Oh, Uncle,
So,
please.
first thing, never attempt, never be courageous that I'll do everything. No, it is not possible. Humanly, one human, and you are not even doctor, and you are dealing with it, it's good enough. So first shout for help. And if you have mobile, at least ring up someone. Okay. First, let the person lie down. Okay. First thing is, so call emergency. Okay. Call for help, call emergency, anything. First, any emergency scenario, do that. Okay. Now, second question. Okay. So it is, the first thing to do is call for help. Now decide. The person needs CPR or not. Sit. Put your hand under his nose. See if the person is breathing or not breathing. So there are three point rule. Look, listen and feel. Look, first what will you see? You will try to see the body. Body is dying or it's alive. Okay? So what it is called? Look. So give a look to the, it is a observation. Okay? Listen. What will you listen? Okay. So there is no heartbeat. Third thing, what will you do? The feel.
Breathing.
There in air. Okay? If all three are absent, Now you are ready for CPR. Now person is according to your observation no more. So any instant help can revive the person and make them live for long. That immediate resuscitation can make you God. A person who died has come back. Can you believe that? It is so magical. In one point the person was dead, and one point because of your help is totally alive and we can become healthy as the person is. Okay? So in actual form what happens? First I will tell you the physiology. What happened in emergency situation? What happened? Why a person becomes dead? What happens inside the body? Okay. When heart will stop, what it will do? It will stop blood all over the body. And which is the most affected area, which is very crucial or critical? Okay. So once heart stops, it stops the blood everywhere, and the most important part is brain, because brain is regulating all the body. So if brain stops, then everything stops. So our work is to help whom? No, we actually are helping. Yes, we will work on heart, but we are helping brain to work back. And that time is how much? What is 3
minutes.
You have to do that. Okay? In 3 minutes, if blood again reaches to your brain, then body will revive and the life will come back. So the time is very critical. That is why CPR in other countries taught to everyone, anywhere. Even the cleaner, the road cleaner, everybody knows the CPR. Okay? Because anytime if CPR is given, a small act can be so rewarding, and that's how we plan to do this class. So at least this understanding can, if somebody can be saved. Though I should not be saying, but still the audience is too less. If it is Bhandara, then there will be 1,000 people. If there is a movie, everybody will come. But if it is a CPR and saving a person, there are hardly people interested. So do you think you guys need any good life? Deserve? As you compare with the West and all, they really work hard for that best life. So the sleeping late today and having good breakfast is more our aim.
Exactly.
See where we are. We don't know what is what. So that, understand? First thing, look, listen and feel. Very simple fundas. First 3, second 3, everything is 3. First was 3, second 3 and third 3. Okay? So look, listen and feel. So first ensure, look, listen and feel, the person is there. Okay? Now you have ensured the person is there. Okay? Now it's last part portion will come. So now how to do the CPR. Okay? So first any appliances is there. So we have to remove this. Okay? Come. So you have seen, right? So I will tell you the exact method. So first we have to sit on our knees, because this kind of posture of mine give me more strength. If I am standing or I am totally sitting, then I will not be having that much of energy to do the CPR. So first is this. Okay? So after lying on, and then second is, this is called chin lift. What it is called? Chin lift. So what happens? There are some blood or something is there, so that will not go inside or person will breathe. Okay, it is called chin lift. So first you will do the chin lift, but don't waste any time for this. you have to 5 to 10 seconds for all this activity. Though I am telling it in a longer portion. Nothing you have to do. You just look, listen. First, shout help, help, help. 3. After that, look, listen, feel. 3. And after that one portion you do this. That should take 10 seconds. That's all.
Madam, if see,
How much time we have? 3 minutes.
Madam, one question: if they call for help, if 10 people come, so 10 people have a different opinion. So
you keep doing your job.
no, why we need to help means what is the main reason for?
Because reason is that CPR goes for 30 minutes.
Okay.
It is not that one time you do and the patient may revive. The textbook says at least you should try for 30 minutes.
Okay.
And one person cannot continue more than 10 minutes, 5 minutes.
Okay.
So that is the-
So he can watch what he is doing and he can also repeat same thing.
So you have to keep replacing people.
Okay.
Maximum one can do for 5 to 10 minutes maximum, best of the health person.
Okay.
CPR is that
So I think yoga will help, right? To strengthening.
So this is the one is we'll do the chin lift and we open the mouth, and anything like if the any cloth or something is there, try to swipe. Sometimes what happens, there are something is inside the mouth, because face is one portion which get injured during car injury or anything.
Accident.
So by cleaning this, so this time patient is unconscious. So anything inside the mouth, where it will go? Lung. And what
Yes.
will happen?
Lung will
choke,
block.
because patient is not swallowing. So any secretion inside the mouth it will trickle down to the another area, that is lung. So patient will get infection or may die because of that. So first remove it. 1 minute, 1 second. After that, keep it. Okay. So where is the heart? So we बेटा इधर आ जाओ, थोड़ा सा उधर शिफ्ट करो, इससे
Super acting.
So where is heart? I'll just take. So you all know a little bit about anatomy. Everybody knows heart, where it lies. So heart is not totally left. If you can see, it is little in the center. Okay. This bone you can see. So main area I want to show with this for the CPR. This is the rib cage, you can see. The heart is lying below it. Half of in the center of the bone and little bit about in the rib. Okay. Anybody see? Okay. So we have to hit this, specifically this area. So don't go too left. It is more left, centrally left. You can see just from the center, little left. Okay. So this is the area of heart I had to show. So one thing, if you want to, you can remove the clothes, but don't waste all the time for this. So if anybody wants to come and see,
You can come.
the anatomy here.
Come. See,
Oh, Mr. Pilot.
Mr. Pilot, come.
You have to revive people when you are flying.
Come.
You know, drown. Come. That will not drown.
Hey,
Or
don't.
some, you know,
Don't.
Can you stop? Stop.
So these are the ribs you can see, guys, which I have shown right now. Okay.
Ribs.
These are the ribs, and there is the central bone. It is called the sternum. This stops here. Heart is here. Okay. Got it?
Left side.
Yes. So this is the area first we decide upon. Since you have seen, so there is no, all the things which I am telling is a practical things which you have to keep doing when you are not with the person. When the real person comes, you are quickly ready. In 1 second you are ready to do. You are so confident. That is what is the workshops and training do. Okay. So we have to keep ourselves updated with the things and train ourselves.
And
So when there is a doomsday, we are ready with the.
and I think, madam, they should not try, without proper knowledge, right? Just for a fun, just for a fun and other thing. Okay. So because I'm just learned there's something, you lay down something like that. Is not supposed to be.
The first portion, na,
Yes.
person has to be
Yes.
Correct.
Okay.
there. You
Should
can die
not-
on a cadaver. You can go to medical college and do the dead person's.
Yes. Yes. Only
So
dead
this is
person
the
he
thing.
can try.
So we have to do the whoso left or right, whichever is your dominant hand. So make a fist like this. Okay. After that, this area that goes here. Okay. This.
For you, close your eyes, sir.
Close your eyes.
No problem. No. He has to open. Keep it open. No problem. Okay. So make the fist and feel the rib cage. Come.
Don't press too hard. Just
Just feel.
Just
how
feel.
much it goes.
Rib is there, no? Yes.
Go.
Keep
Go,
on,
doctor.
The feel and the training is important, beta. There is not textbook
Just
that will tell you.
see.
Textbook
Rib
बहुत है हमारी
rib sense
India
ಆಗ್ತಾ ಇದೆಯಾ
हमारी
ಗೊತ್ತಾಗ್ತಾ ಇದೆಯಾ rib
No,
touch
you
ಆಗ್ತಾ
did not
ಇದೆಯಾ
do the properly. Come. I'm here to train you, not to teach you.
This is
Teaching के लिए
life.
तो तुमको कोई भी YouTube पे देख लो. Can you feel the dip? Fast. Ma'am,
Fast.
Hey, chips, come.
got it? How much it dips? Hare Krishna, come. The posture is wrong.
That sitting posture also matters.
Be always like this. Fast.
Don't press, just have a just touch.
I think he is in a mood to give CPR.
Super. Yeah.
Don't be soft. Put your this hand. And it is actually for you guys, which I have come for. But none of you have are attending. It is for all the elder people.
Yes,
They
yes,
themselves
yes.
are not knowing what they will
Yeah.
teach kids. Nothing.
Yes, correct.
Got it?
Next one.
You could feel this?
Yeah.
No, you just push it and feel how much you can push. No, not here. This has to be this. Otherwise you can't push. This.
Okay.
अभी pushing तो मैं अब बताऊंगी आपको. मैं तो I just giving you feel. Yeah.
Yes.
I have 10. So this has to be the area. This is the. You can see this dip. Okay. Come quickly. So please sit down, all of you first. Like, yeah, this area and this.
This is rib, is it?
You can feel the up and down.
Yeah.
This. Okay. Now sit. So how much pressure you have to apply? Anybody
That's
guess?
important. Very important.
This is the only touching part. How much pressure you should apply? Any guess? You should apply the pressure that this area which you were feeling should go down 1.5 inch.
Oh,
1.5 inch.
At least ये हड्डी टूट जानी चाहिए. You that much the pressure generally they say कि many of the times the rib cage breaks.
Yes.
Okay, the pressure is that much. That is why I said कि one person can't do it for long. So this, and you have to do how many times? That dip is 1.5 inch, and how many times?
3 times.
30.
30.
So one person 30. If there are 2 persons, then
60.
60. In one, and how many? The 60 count should finish in how much time?
3 minutes.
No, 1 minute.
1 minute. 60. It is a maximum 100 count. You should be able to do the 60 pumping, and that is also 1 inch down. So understood? You must have seen in movies, they do it very vigorously and fast. So both the things are important. Vigorous and fast. Vigorous means depth. Fast means jaldi.
Fast,
Very
fast.
fast. No time gap should be left. So you do it. If one person is there, do for 60. Fast. If there are 2 persons, then they say do the 30 and give 2 breath. The another person will give 2 breath. Then the same person will do the 30. If one person is there, then do the 60 in one go. 60 count, the vigorous and the fast movement of this to the rib cage, to the heart, and this your work is done. Enough for you guys to do that much more. So if nobody is there, then again, so after 60 or after 30, you have to give 2 rescue breath. Rescue breath, anybody knows? Movie mein dekha hai na? So rescue breath, what we have to do? Again chin up, open mouth, and you have to breathe inside the mouth to rescue breath. You have to take a deep breath and push it inside.
There.
What you have to do? Push your exhalation. Got it? Take a deep breath. Seal your mouth onto this and to rescue. And again start.
How many times, madam? That.
Huh?
So, blowing how many times? 2. Only 2 times.
2 breath.
2 breath. One, take a deep inhalation, blow. One more, throw. That's all.
So what is this I am sending inside? What is
Air.
this? How it will help? Exhalation, oxygen to hai. So it is the carbon dioxide I am sending. Or carbon
Action.
dioxide, what it will say? It will stimulate your brain to breath. Okay, it is not oxygen. It is the carbon dioxide I am sending inside. Okay, so maybe sometimes that stimulus works and patient just get. So understood the whole sequence? 60 or 30, whatever you can do. 2 breath, again start. 2 breath, again start. 60. Fast. And that you have to continue at least for 30 minutes before declaring the person dead. Got it?
Any doubt?
So that was all about the CPR. I hope you got the little hand on and little understanding about that. So the practical portion of this, the heart is lying under the cage. By doing all this, what I am doing to the heart. So what pumping will help?
It will help blood flow to all.
Yes, very right, very true. Okay, मैं heart को धक्का, I am just pushing, I am just boxing to my heart, which is dead, which is not showing any activity. So sometimes just doing the pressure activity. Heart, just the blood circulation as a pressure effect. Just start. Sometimes it do happen na, we are having pain, we press it and just we release it there. Even we rub it. Why we rub things? Increase the blood flow. It's same way the heart is the bigger portion and it is behind the neck. We are rubbing it. By doing this is like a rub. So the circulation improves or just suddenly starts in that move. Okay. So by doing pressuring, we are letting the heart work and to open the blood circulation to start. Only that much the work we need, because as soon as blood will start, it will go
Brain.
and our work. If one portion of the blood goes to brain, our work is done. At least brain start functioning, then it will take care of the body. Then if there is any bleeding going on, anything, that will all will can be taken care later. The first is the brain. We have to revive the brain to take over its own body. That's it. That is, as an external person, that is only our work. Okay? Understood everybody? Any question? First 2 questions. Yes.
Finger,
If there is-
pause finger.
If the rib cage breaks, should we continue the CPR?
Yes. Till the time, because a person is already dead, if rib cage goes or any bone is broken, we are not worried about it. We are worried about life. Okay? If you felt that rib is being broken, continue your work. Okay? That is true.
Mom, how many times should we do that? And
30 minutes. So 30 minutes mean 30 that sets. You can understand almost 25 sets of CPR. 25 sets of CPR. Understood? In 30 minutes you should be able to finish up 25 sets. 25 sets, what is a set? 60 plus 2 or 30 plus 2. Okay? 30 plus 2, 30 plus.
I think that need more precautions, right? I mean, road accident is suddenly someone road accident. So we cannot do CPR and other thing, right? So in that case,
CPR for everyone.
no, even accident,
I told no, if it is in car or something, you have to drag and
Oh,
make
okay.
them lie down and do
Okay.
the CPR.
So make sure, okay.
Yeah.
Fine.
Generally, in these kind of accidents, the cardiac arrest is less. It is more of the bleeding
Bleeding, yes.
and brain injury. So they are not very good cases for CPR. Actually, the cardiac arrest is a very good case, which can be revived. But still, whatever it is, CPR to be given. There are so many cases which were, magically, revived for other problems. Like even with the bleeding also, what will collapse? Heart. So by dropping it again, we are improving the circulation whenever the patient may survive. What it means?
So
You are divine, I am divine. Okay?
So and one more good claps for Sumit to give a very good So thanks all of participants for coming. So you are lucky ones. See, doctor at least she has taken her own time and
It is my 5,000 time.
yeah, she is with her busy schedule. She wants to help people, but what to do? People are very lazy and they don't know the value of life, and they're just doing the blame game. So this is because of that, that is because of that, but they are not serious. Okay, anyhow, so thanks once again, Priti madam. So thanks for coming and probably.
I'll just have a glass of water.
Sure. You
Understand? Pet dog, non-pet dog, any dog. Nowadays that concept has gone that pet dog bite, we can wait and watch. Nothing. Always go to the hospital, rush to the hospital, give first injection. And other things can be decided later. So any dog bite is which injection to be given? Anti-rabies, day before anti-rabies. Okay. So any dog bite, pet dog, non-pet dog, stray dog, anything. If you see any tooth has gone inside, then immediately to the rabies, anti-rabies. These are because very serious diseases. Dog
Rabies,
bite or snake bite, they will kill you. So doing more is better than doing less in these scenarios. Chalo, guys, folks. So just to brush up small points. One is very commonly is the wound, of course. So चोट लग जाती है. So what to do? Do's and don'ts. Fast I'll tell. So do's is that first wash it with any injury outside and anything, just with the clean water. Tap water, just put it the tap water, don't put any hand. Okay. After that, what to be applied, which is good anti-inflammatory, is betadine. Everybody should keep a bottle of betadine at home because that is not irritating. Ceylon is not, Dettol is not. They all irritate very badly. So betadine is a right solution. One should keep it home and clean it with betadine. If it is a small wound, just leave it open. If it is a bigger wound, then do the dressing. Okay, dressing, you can have a mucorocin or all. Everything is written in that. If you want to take a picture, take a picture. Mucorocin, any ointment, put an ointment, a cotton and bandage. Okay. Otherwise that, if a small wound is there, then adhesive tapes, micropore or there is a band-aid available, then put it. So by that you just have to protect the wound area. It should not get the injury and it will heal up. Okay. Second portion is the fracture. If somebody gets fracture at home, what do you do? Okay. Only one thing you have to keep it in mind: stabilization. Any portion which your grandmother or anybody said, "Haath move gaya ye." So what you have to do? The stable. Wherever it is, just keep it in that position. Okay. So what you can do, either you can put that cardboard. It is called splinting. Okay. So wherever it is just support that area. Don't move it too much, because moving that area too much will displace the fracture. What if like my bone is broken here and I keep it just like that, okay, and reach to the hospital, so it is in the place, so you don't need much work. And if I move it so much, the one bone goes this side, one bone to it, the patient may have to undergo surgery. But if it is the fracture which is in the line, then only plaster can help the patient. So any fracture, anybody says my bone is broken, generally by and large people do understand, yes, my bone is broken. So at that moment, if nothing, like I had this fracture, so what I do, anybody who is helping me to do is keep this leg out. Like I should not be keeping it on the ground. So it remains, like people should help me, getting me to the hospital, keeping my leg away from the bone. Okay, understood? So that way, any fracture area should not be moved. If it is hip bone, then you have to carry the person. Anything, hand bone, then that hand area should be kept as it is, wherever whatever fracture is. Don't move. Okay.
My mother's thumb is fractured here.
Your thumb is gone?
Not mine. My mother's
Okay. So what is the treatment?
hairline fracture.
Okay. Now it's good?
1 year ago.
She should do the physiotherapy.
She's doing.
Therapy.
He's still trying to do 1 year ago.
It's a small fractures. There is sometimes no problem. If any problem is there, then ask your mother to talk to you. Okay? So the third thing is burn. Burn is whenever you get an injury, when it is a big injury, then what another precaution you have to take? Whether you are on the road and just fell down and a big wound has happened. So first thing is tetanus. Don't forget it. Always rush for the tetanus dose. And tetanus has to be given within 24 hours of your injury. So anytime any injury which is in the dirt area or by the iron, anything, generally any area is contaminated. Think of this. I get hurt by this. They are having tetanus there. Anything. So first take the tetanus. If it is not too, it is very small, then it's okay, like a small cut and all. Though that also to be protected with the tetanus, but not then. The first thing to go and take a tetanus and then dressing and all can be done. Now third thing is burn. So what do you have to do the burn? So take under the cold tap or water and apply some cream or something, and after that you can take them home. If blisters are there, don't poke them yourself. Okay, if you are poking, then it should be sterile needle. Okay, so take the water out and then do the dressing. That generally, if that kind of burn do happen as it is, we will go to hospital. So burn itself is a full class, so I am not taking it longer. How do you protect from the burn? What is the percentage of burn? How deep can be the burn? What kind of burn?
Yeah.
There is electric burn. There is a electrocution has a different way to affect the body. The fire burn is different. All these things. So that is all. And last but not least is the snake bite. And
Important.
the dog bite. Okay?
Dog bite.
Snake bite. Again, first it is mostly during night time. So first you have to ensure that was a snake bite. Okay? Even if you are not sure that it was bitten by something, it was rat or a snake, sometime it do happen. Like I remain in a foresty area, so there are so many rats going on, snakes also, and other animals also. So whatever it is, always give benefit of doubt, and benefit of doubt is go more than the less. Always take the person to the hospital. Then they will ensure by the bite mark that it was snake bite or not. Okay, first. And second thing, if nothing, then you can apply tourniquet. Tourniquet, you know, wherever the bite is happen, just pressure bandage on up above that level. Like if it is bitten here, so just try to stop the blood circulation. If it is here, then try to put just a bandage or a tight cloth. You just move it till the time you reach to the hospital. So flow of poison will be little less. Okay, but nothing. You have to go to the hospital, and they generally in hospital they have to keep the person under observation to understand is it a poisonous or it is non-poisonous. First, they will not give anti-snake venom then and there. एक मिनट में नहीं देगा. You have to observe the patient because anti-snake venom has its own side effect. So it has to be ensured that the snake was
Poisonous.
So they will keep you and then
Water you want?
so glass is there.
One second.
There. At least you educate us. You educate us as a carer. You know, educate. My kids too educate me. Every day they scold me. You don't know how to cook tomatoes. You don't know how to cook that. I said, you please take care of your. You don't know what is going on.
Instead of the gesture, then do it by yourself.
How to do it? That's why
Then what
we all need courage, na, to speak our voice. And courage comes by training, hard work, and
Knowledge.
that's good. You have to take the burnt of that. When you say you scold your mother, then you have to show up. Like when my kids are scolding, I have to listen because they do it.
Positive.
So, be it French architect,
Same what ಬಂದಿದೆ ಅಂದ್ರೆ
Roman architect,
ಪಾಟ್ ಮತ್ತೆ start.
before Christ, after Christ.
ಸೊ
Be it something
ಇದೇನಾಯಿತು ಇಟ್ಬಿಡ್ಬೋದಿತ್ತು
people
ಅಲ್ಲಿ
never knew.
ಸ್ವಲ್ಪ ಹೊತ್ತು ತೆಗೀರಿ ಸ್ವಲ್ಪ ಹೊತ್ತು ತೆಗೀರಿ
ಅಲ್ಲಿ ನೋಡಿರ್ತದಲ್ಲ
Charan, you were or 60 plus 2, whatever. So 16 plus 2, 16 plus 2, 16 plus 2, 16 plus 2. That uncle is a
means because